The burden great at the Princess Margaret Hospital, and so much so that healthcare workers say the facility is not nearing, but has already collapsed, giving the media a first-hand view of the dire situation at the country's primary public healthcare facility, with those on the front line of the COVID-19 pandemic. Our Kelsey Johnson has the details.
Good evening, Makushla. Good evening, Bahamas. I'm outside of Princess Margaret Hospital, the main entrance to the accident emergency part. Here we were able to tour the facilities to see exactly what is taking place since the recent surge in COVID-19 cases. I can tell you that the doctors and nurses here at this hospital facility, they are saying that they are overwhelmed, tired, and frustrated. Their message is simple. If you don't have to come here at the Princess Margaret Hospital, don't come. Joining me live on this feed is Assistant Director of Communications here at the Princess Margaret Hospital, Ms. Thelma Fernanda. Ms. Fernanda, if you can just tell us exactly, paint us the picture, the realistic picture of what is taking place here at our #1 healthcare facility.
Okay, so today we thought it, meaning the management of the Princess Margaret Hospital Public Hospitals Authority, we wanted to be able to give the public, through the eyes of the media, an idea of what we're experiencing here at the hospital. And what we were able to show the media and the public today is pretty much just how horrible it is here at the hospital in terms of the increase in numbers of COVID patients and just even your acute patients coming to the hospital. And so we're encouraging persons, if you do not have to come to the hospital, if it's not an emergency, please either seek the community health clinics or a private facility in the community to be able to seek care, because right now we are bursting at the seams in terms of our admission. So the media was able to have a tour of the accident emergency department to appreciate our acute patients who are non-COVID, and also the volume of patients that are coming in, our patients under investigation, and our COVID positive patients in the hospital waiting for admission. And I think one of the things that I think we wanted to do is we wanted to give you the reality of it and see it firsthand, how horrible it is here at the hospital. And I'm using very choice words because that's exactly what we're feeling. The staff here at the hospital, our medical, our physicians, our nurses, support staff, you name it, food services, grounds, housekeeping, are exhausted. There is a lot going on. We're trying our best to provide you with the best possible care, but the numbers are increasing every day. Go ahead.
Ms. Fernanda, if you can just give us an idea of how many positive patients we have here at the hospital. I know we were able to take a tour of the special pathogen area.
Correct.
35 beds, only
beds,
one available.
One available, and you had up to about 22 patients in our repurposed general practice clinic area where we house our PUIs, but out of those 26, we had over 22 patients that are positive waiting for a bed. And if you only have one bed available in our special pathogen unit, that gives you an appreciation for what's happening in terms of patient having to wait for a bed space. Okay.
People have seen pictures and videos circulating over Facebook and other social medias with persons being housed outside of the specific areas that they were supposed to be housed. Have we been able to make sure that those persons are able to get beds and they're getting the hospital care that they need?
So even the persons who are awaiting admission, even in the space where we showed you in General Practice Clinic North, those are the patients awaiting admission, but you have an appreciation for what that space looks like as well in terms of our nurses and our medical team being able to still provide care despite the fact that they're not on a COVID quote-unquote ward. So we're able to, like we said, repurpose and make makeshift ward spaces, but of course they're not the best and ideal situation for a patient who needs COVID direct care from our clinical team.
Ms. Fernanda, if I could just take a minute to bring this home for the general public. I spoke to Dr. Hall. She is actually the head doctor right now in A&E, and she was telling me that a patient is in Abaco, is in desperate need to be flown here to the capital for health care, and they aren't able to house that patient. So we just want to give you an idea as to what is happening here. The number of bed space available, only one particular bed space is available now. That's in the special pathogen area. That was the makeshift particular hospital that was donated from Good Samaritan. So Makusha, we're going to get more on this. We're going to give the public an update as we get more information, but I'm going to toss it back to you in the studio. Reporting from Princess Margaret Hospital, I'm Kelsey Johnson.
If you missed anything, we've got you covered. Subscribe to our ZNS Network YouTube channel and follow us on our social media platforms, Facebook, Instagram, and Twitter for breaking news, live event coverage, web exclusives, and much more.